Hey everybody, it's Dr. Pearlman and I wanted to make a video post-run today, which this one was a little bit more of a very brisk trot jog, but I've been feeling a lot better, starting to really get back to the old running every day, Dr. Pearlman, prioritizing exercise. And if you don't know by now, or if you haven't been watching or following, being part of the channel, the Dr. Pearlman TV channel, then you wouldn't know that, of course, this is following pretty invasive back surgery, following many years of sort of a lot of limitations and being able to always stay as active as I want. But the reason we need to talk about this is that a lot of people don't understand the relationship that is needed to have, both massage or body work. I like to call it body work or manual therapy, soft tissue work. Associated, not like therapeutic massage that's relaxing, but massage that's like specific to correct an issue that you are having that taps into the nervous system, a lot like a chiropractic adjustment, but completely different. And that is what I want to make a video about right now. You got to understand something. The nervous system and the way that your brain and spinal cord, which is your central nervous system, interact with stimulus from your environment, whether it be emotional stress, whether it be physical stress due to trauma, whether it be toxic insult or stress due to food you ate, whether it's repetitive injury stress due to lengthening of fascia and tissues and tendons or sprained ligaments that really affect and swell up a joint, okay? Whether it's a million other things we could talk about, whether it's viral, bacterial, okay? This affects your body in a lot of ways. Now, when your body harbors a lot of inflammation and protection in a given joint, oftentimes that joint is being protective of your spinal cord or in your spinal column in a way that inhibits your nervous system from expressing itself to the best of its ability. You might have heard me in a video talk about tone one time. So what happens is your body will never truly have the ability to adapt if you don't ever get that chiropractic adjustment to that joint. And why am I saying it like that, almost as if it's a universal law? Is because in my experience, the people that have the most amount of emotional or toxic or trauma or whatever inflammation and injury to a joint never get a chance to actively rehab that or don't get enough from a massage until they've had the adjustment to really release that joint properly. And when I say release that joint, that's what we talk about in chiropractic, is having a cavitation. That's the cracking of a joint. That's that satisfying crack. I feel like it needs to crack. Until that pressure gradient has been changed, there it is, and again, it's a different term, right? A pressure gradient's been changed. Your body does not have the ability to adapt. Now let's talk a little bit about massage and how that complements chiropractic or vice versa. I really prefer massage therapy or soft tissue therapy, okay, over chiropractic when it comes to extremity injuries, even if you've adjusted the extremity. So even if I adjust your wrist, even if I adjust your ankle, even if I pull on your finger and your thumb, my patients, I love to adjust the toes and the hands and the thumbs. And there's a lot of benefit in terms of like cerebellar stimulation and how the body can balance. There's a lot of reasons why you might want to do that if someone has a little arthritis or tendonitis. But if someone has a real musculoskeletal distortion, they need to be seeing a great massage therapist. Now, I'm very lucky. My massage therapist, Adriana Morales, here in the Dallas-Fort Worth area, I believe is maybe the best in the world. I mean, she's certainly the best that I've ever been around in all my years around physical therapy, chiropractic, doctors, massage therapists, sports rehabilitation, all that. All the years in CrossFit, I've never known somebody that was as good as her. And what I've noticed is my getting adjusted does what getting adjusted does in terms of that nervous system stimulation and pressure off the spine and resetting the joint. But going to her as a compliment now that I'm back being active and I've begun to recover is irreplaceable when it comes to the way my knees feel, the way my hips feel, the way my shoulder feels, okay? And I'm not saying that you shouldn't go to massage therapy for your back. Just remember everything else I said leading up to this moment. So if you think musculoskeletal fascial distortion, if you think tendons, ligaments, muscles, muscle belly, corrective planes where you're really kind of just out of whack because of repetitive motion and a lot of trauma as well, that manual therapy, musculoskeletal massage therapy, and corrective massage work, that is so important. Never let me or anyone else mislead you or tell you that somehow it's not important, because it is. But I'm sitting here telling you at least what I believe from my experience and what a lot of the evidence is going to suggest, that soft tissue is going to be better served under those circumstances. And chiropractic is going to be better served, and or if nothing else, that gateway where you may never be able to move pain-free, or you may never be able to feel the balance that you wanted to, or that these other neuromuscular rather than musculoskeletal, think neuromuscular, circuits won't really flow the way that you want them to flow, and never really have that ability until you start incorporating the chiropractic adjustment, at least first. I'm going to leave it at that. If you guys need anything, I hope you know to just click on the bio, click on the link, Dr. Pearlman TV. You can set up a consultation. You can do an inquiry and say, hey, I'd love to do a consultation. I do online Zoom consultations. But, obviously, if you're in the Dallas-Fort Worth area or you're in need of chiropractic, obviously it's easy for me to give you a referral if you're across the country or if you're in a different part of the country. But if you are here in Texas, I would love to have the opportunity to care for you chiropractically and get you going on the right track to healing. All right.